Okay, do you want to introduce yourself first?
Well, my name is Javiera. I'm, as you can tell from my accent, I'm not from Canada. I'm from Chile, but I live here now, and I've been here for the past 7 years. And I'm doing my PhD in the University of British Columbia in the School of Population and Public Health. And I'm studying what's the effect of mental health conditions on how youth transition out of foster care and into independent living. That I'm doing that with a population-based database and a small qualitative study with some youth who we know have a mental health condition.
Jade, would you like to go next? Tell us about who you are. Maybe Petra doesn't know.
Oh, yeah. So I'm a student of Philip Mendes in Victoria in Australia. But I've also worked on a lot of leaving care projects in Victoria. People tend to apply for grants with really grand ideas about how many young people they'll get into their research projects. And many years ago, I was working at the Peak Body organisation for young people in care, and so they would come to us and tell us that they were going to do this amazing project, and we would say, I don't think that you will. And then sometime after that, when I was working part-time, then they would offer me a job trying to get the last of their sample. And so I've worked for pretty much everyone in Melbourne and Victoria, and that has given me the great pleasure and honour of working with a lot of the same care leavers across a million different projects and programs and things as well. So we've got some really, really amazingly talented and very, very clever young consultants and youth advocates and lived experience consultants in Melbourne and across the state. So I do a lot of work trying to promote youth participation in child family welfare reforms here in my spare time while I'm not doing my PhD, which is on care leaver early parenting. And I was working last year on our brand new framework for young people transitioning from care in this state. And now I'm working back at the Peak Body organisation with the youth advisory group for the extended care pilots in Victoria. So that's very exciting.
Petra, would you like to go next?
Yeah, sure. I'm Petra. I'm a PhD student from the Department of Social Work of the Royal Holloway University of London. But currently I'm joining from Germany because I'm visiting my family here. So my research is about the occurrence and influencing factors of suicidal ideation among care leavers in a cross-national comparison between England and Germany. I've just started actually my data collection as a mixed methods approach. So I'm doing an online survey and also plan to do a qualitative interviews with a few of them. But the coronavirus pandemic affected my study, unfortunately, quite negatively. So it was actually supposed to start in April, but it wasn't a good idea to start such a topic by then because it was then lockdown in Germany and in England, and it wasn't the best time to do that. So just started last month, but it's a slow process. So it's a bit frustrating at the moment, but still in the beginning. At the moment.
Petra, I missed what country you're studying in. I know you're from Germany.
Yeah, but I'm England.
Got it.
And Germany.
That makes sense.
England. Yeah.
Got it. Thank you.
Sorry, the connection is sometimes.
I'll go because I'm the last person. Judy Havlicek, and I'm an associate professor at the University of Illinois in Urbana-Champaign. What else can I tell you? So a while back, I did a kind of a systematic review of studies in the United States and what is known about mental health of care leavers. So that I think we can talk a little bit about that, at least in the United States. More recently, I I've been thinking about trauma and the ways in which I think child welfare systems are, at least in the United States, they're intended to protect young people, but I think when they're in care for extended periods, I think that's debatable, at least in the United States. So I've been really thinking about how child welfare systems actually create more risks that contribute to, I think, poor well-being, poor health, poor mental health. So we can talk a little bit about that. It's not a surprise, I don't think, but I think it's harder to figure out sort of what child welfare systems could do realistically. Like, I don't necessarily know how to change that, but we can talk about it. All right.
Someone else.
Sorry?
We have someone else
Oh, great.
joining.
Hi, good afternoon.
Hello. Welcome.
Thank you.
We're
Thank
just
you.
starting with introductions, and we just finished.
Oh, sorry I'm late.
That's okay.
I'm on. Hi, I'm Mina.
Mina.
Yes, please. I work at SOS Children's Village, Ghana. I'm in Ghana. And I'm in one of the villages. That's the Kumasi village. So I work as a sponsorship officer here at SOS Children's Village, Kumasi, where I write progress reports and sponsorship letters for the children. And I take pictures and videos of the children. So that's what I do here.
Great. Welcome. We are all from different countries, which is amazing if you think about it, right?
Yeah.
Zooming in. So Mina, just very quickly, I'm from the United States, Illinois in particular. Javiera is from, she's in Vancouver, but she's from Chile. Jade is in Australia. Petra is in England, is that right?
No, I'm studying in England, but currently I'm in Germany.
Sorry, that's what I meant. So she studies in England, but she's from Germany, and her study is actually looking at both
Cross-national.
Yeah. Yeah. So you have a little bit of a context.
Yeah.
So how should we start this?
Did you have anything, like particular things that you were going to cover from stuff that you found out?
So I can tell you a little bit about what I learned from the systematic review, and then we can maybe use that as a springboard. It sounds like many of you are studying mental health now, so that'd be, I think, really interesting to explore and hear more about.
Yeah,
So
sure.
myself and Tony Garcia and let's see, Doug Smith, who is a substance abuse researcher, not a child welfare researcher. We did a systematic review of the research in the United States on mental health, what's known about the mental health of care leavers, and I think it was published in 2016. It started in a class that I took with Anola Proctor at Washington University. Anola Proctor she's retired now, but she used to be a mental health services researcher in the United States, very well respected. I took a class, and a lot of her readings were on the child welfare system. And so for the final project I reviewed, this was the final project of that class, and then I turned it into a publication. So what I learned is a lot of studies, so that not much is known, in part because a lot of the studies that have been conducted haven't used standardized instruments that are valid and reliable for identifying a mental health diagnosis. There were only a handful of studies that have. Mark's Midwest study was one of them. I believe that Curtis McMillan, who was also at Washington University, he had a study called Voyages that was specifically looking at the mental health diagnoses of young people who aged out. And then there might have been a few others, but they're not coming to mind right now. But even among those studies that used a valid and reliable measure, my memory is that they weren't consistent. So even if they did identify a mental health diagnosis, it was difficult to make comparisons because they used quite different measures. I think the other sort of finding from that study is that the range of mental health conditions were not really they covered a small range of conditions, as you might imagine, because So in the Midwest study, they used, I think it was a CD. That's a huge study. And so the actual mental health questions, really couldn't take up a huge portion of that survey. So the range, I think, of conditions that they identified was somewhat narrow, for instance. That's my memory too. And I think the main finding is that of the studies that have used a valid and reliable measure for mental health, PTSD was the most prevalent mental health condition, followed, I think, by depression, and then some kind of behavioral disorder like either ODD or conduct disorder. Mm-hmm. Those were the.
Were you looking at substance use as well?
We did. We looked at, yes. And so those, interestingly enough, they were lower than same age peers in the general population, the substance use disorders. But what was higher is use of illicit substances. So young people who aged out were more likely to report using illegal illicit substances than same age peers in the general population. Mm-hmm. And they were they were more likely to report using those substances at an earlier age. And so Doug Smith really felt that was a pretty big risk factor for possibly some problems later. Mm-hmm.
Yeah, or it could be coping thing that they're already manifesting another mental health condition.
Yeah. Yeah, and I don't know of many other studies that have looked at mental health. So I know Colleen Carey Katz at Hunter University. She's interested in suicide. Yeah. And so that might be an area that some of you might want to connect with her about.
Mm. Yeah, I read, I think, 2 papers by her. Yeah, and also what you mentioned about the tools, that for each study, when you do a review, they use different tools, and it's so hard to compare. And this is also what I found out about the risk of suicide or suicidal behavior, just a diagnosis of that, whether there is a risk or not. And in these studies, when it's about caregivers, and there are not many about caregivers, rather looked after children, they all use rather different tools, and then it's just one item ask about it, but not like these theory-based tools, which are more in-depth in a way. So I think this is really difficult then to compare also countries. Nevertheless, when it comes to suicide or mental health, every country is a little bit different to that. So I think this is really something that I also read in a review from, how's it called? Annemiek Harder, I think. She also mentioned that actually there should be something like a standard of tools so that a comparison also can be done in a way. So I think that's really important to do so.
Yeah, I think a lot more work could I think illuminate sort of needs and understanding better. So do you want to talk a little bit about sort of I guess dimensions of mental health maybe that you're interested in?
Hi. So if it permitted, I have a colleague here. So I guess he would introduce himself. He's having challenges with his network, so he's joining me.
Great.
Hi.
Hi. Hi.
Yeah, thank you. My name is Wisdom. I'm working with SOS as youth development worker.
Welcome.
I'm happy to meet you. Thank you.
You want to tell us a little bit about SOS Villages? I know a little bit about it, but not much.
Okay. Probably I will zoom it on what I do as a youth development worker.
Right.
What I do as a youth development worker. Yes, I basically work with young people who are 14 years and above. And my job mainly is to help them identify their potentials and also help with their educational issues, talent development, and resilience building. so that when finally they are leaving here, they'll be able to fit into society and be able to take care of themselves and their family members. So basically, that is what I do as a government worker.
So yes, as to add to what my colleague said, SOS Children's Villages, we're a child-based organization. We work in the interest of vulnerable children. So we have 4 villages in Ghana. We were established 45 years ago, but this particular village was established 10 years ago. So we have 4 villages. We have one in Tema, which is in the capital, Accra. We have one in Isiakwa, that's the middle belt, one in Kumasi, and one in Tamale to serve the northern belt. So we have 4 villages. We have, in our village, we have about 119 children who are in various family houses. So we render child-based, family-based care. We do family-based care where about a maximum of 10 children live in one family house with their mother. And then we have a village father who is the alternative care coordinator who acts as the father for all the children. We also do FS, that's family strengthening. So just as the children's village take care of children who have lost parental care, our family strengthening program takes care of children in families who are at the risk of losing parental care. For instance, families who are poor, like very poor, or who are not in, who do not have the capacity to take care of their children, and these children might lose parental care if they are not helped. So our family strengthening program reach out to these children. We support the families with businesses so that they'll be sustainable to take care of those children, so that the children don't end up on the street. So basically, that's what we do. So we in the village take care of the children in the village. All the children have sponsors, some don't. So we rely on local and international sponsorships to take care of these children. So yeah, that's basically what we do here. And I'm the sponsorship officer, as I said. I handle sponsorships, and my colleague Wisdom handles the young people, actually, in the village.
Wow. What does the child welfare system look like in Ghana? Like, is there a formal system that, cares for children when their parents can't?
Well, I think I have to take a minute. Okay. Formally, in Ghana, anything formal is normally done by the government, but because of financial issues, the government is not able to do that. So most of these things are done by NGOs. Yeah. So, and these NGOs have to, though they do it in collaboration with the government, because when you set up a place to help children or vulnerable people, you must seek permission, you must have the necessary papers to be able to operate. Yeah, so the welfare system basically is dominated by NGOs.
Got it. And what about mental health?
Come again?
Mental health.
What about mental health? Do you have like a formal system that provides mental health care for kids and adults?
We do. Generally, it's there, but in the SOS, it is now that SOS is incorporating mental health into our childcare system.
Okay, yeah, so as that's what my colleague said. Yes, in Ghana we have like the government-owned children's villages. Here in Kumasi, we have the Kumasi Children's Home, which is run by the Department of Social Welfare. So we have a department for social welfare. So they handle that children's village, that's the Kumasi Children's Village. But as you know, they are under-resourced and all that. So basically, we, the NGOs, and especially SOS Children's Villages, are like the more organized form of childcare.
And are you partnering with any of the anyone around, like evaluation of services or any kind of research of SOS, even like your prevention services? Is that helping families, or is there any kind of research component to any of that?
Yes, for research, most of the researches are done by other organizations that, depending on what they want to find, the one they are looking for, then we collaborate with them to do it. But currently, SOS, by its own standard now, has monitoring and evaluation department, which is supposed to ensure that we those officers are able to monitor the activities of other staff to be able to ensure that at the end of the year, whatever we set up to do for these children, we'll be able to achieve them. Yeah, so for now, we have a department for monitoring and evaluation.
Can I ask a question?
Yeah.
Yesterday, Gertrude was talking about her research on the meaning of family for young people, and we were having a little bit of a sneaky chat in the chat function about talking to young people in care about their families and whether it's well, I was saying that because my research is sort of looking at that, I was a bit worried that it was a sort of a dangerous question to ask people if I don't have a lot of support to have available for them after having that sort of a discussion. And because I feel like maybe it's something that we've not thought a lot about in this field, or not spoken to children and young people a lot about, but also maybe something that's quite fundamental. And so she was saying in her experience, it's very emotional and can be very, very difficult to discuss, but then like the same level of appreciation for having the discussion at all. So I wonder if you think in terms of mental health and things like that, what kind of role does thinking about family and potentially missing family, or missing having like what is a normal family in your culture, what impact that has on people?
I think what you're asking is probably something that all of us have grappled with, which is in research, how do you ask young people questions that we at least perceive might be stigmatizing or even challenging to answer, right? Even around mental health, I mean, I think it's hard to ask questions about symptoms even. To me, I still think though that that's an open question, and I keep urging people to ask young people what it's like to be asked those questions and not assume that it is challenging, because I think it's preventing us from asking questions that matter. And at least in my own research, when I talk with young people, it's less about those questions about family and loss and even mental health and even sex. So, like those topics that are just difficult to talk about. It's less about that, and it's more about how we create a relationship with participants, and also I think include them in our study designs. I'd be curious what other people think, but.
No, I agree. And what I experienced during my pilot test, where I also got with some caregivers, reflecting on my survey, some were really keen to include even more questions about family, particularly about siblings, because the bond to siblings was very strong to most of them, and they actually wanted to talk about siblings particularly. So I didn't have the impression that when it's about siblings, when it comes to family, that this is sensitive. It's more like this is a really big and important part of family if they have them. So I think we shouldn't assume that it's really challenging, just because they reflect also on family and where they're from. So I think most of them are in a way reflective on family in a way. So yeah, I didn't have any negative experiences so far.
I think that the last part Judith mentioned about including youth in the study design it's key. It's trying to gauge from them, at least what I'm doing for my study, which I haven't actually started, but we started an advisory group to design the small qualitative study with youth and with social workers and nurses. I was kind of trying to get from them kind of what they thought of the questions that we were going to be discussing, and designing a procedure for if it happened that a youth was having a strong reaction, because I am not a mental health professional or a social worker, so I'm not actually equipped to help them in the best way, but to try to design with them a procedure for that. And they, for example, some of the youth, one of the things they mentioned, we were discussing doing in the interview kind of a timeline to try to use that for the discussion, and they shut it down fast. Like, I don't want to discuss every traumatic event from my past. That's going to derail the whole thing. That's one thing that they thought.
That is interesting.
Not conducive. Yeah.
Yeah.
So
I agree too. Oh, go ahead.
Yes. So for the job I do here as the sponsorship officer, I need to get to know the children.
Yeah.
So you need to get to know the children so you can write very good stories about them to their sponsors. So, and SOS Children's Villages Ghana, we have this, we've added this care option of letting the children finding their like family, if not maybe biological, but their family, like extended family. So during the summer vacation, as you call it, that's we call it long vacation. During their long vacation, they go to spend the period with their families, their biological families. So usually, so when it comes to like family, it's always a bit easy to interact with them. So when they return from vacation like this, when they come to me, they come to my office, I ask them, we talk. So I was like, okay, how did it go? What were some of the things you did? Who were some of the new people you met? Because as they go, they get to know new members of their families, people they didn't even know where they were related to. So I think for the topic of maybe background family, I think it's quite easier with us here because we get to interact with them when they return from vacation. We get to ask them all that they did when they were on vacation. And if sometimes I go the extra mile to ask them, okay, would they like to spend the next vacation with those, the people they spent it with? So they get to explain if they will, why, and if not, why. So I think it's been quite dicey, but be easy.
Yeah. To add to that, generally in Ghana, when we talk of family, we are not looking at only father, mother, and children. We have a broader system that we practice, where you are looking at uncles, you are looking at cousins, you are looking at aunties. So when someone tells you, this is my family member, that person might not be the immediate biological family, but a very extended one, a very extended person, but we put them all together, we accept them as family. And that is what really holds us together, such that if a child even loses his or her biological parent, and you are still talking about family, they know that, oh, my uncle is my family member, my aunt is my family member, my cousin is my family member. So basically in Ghana, we have a broader system when it comes to family. We are not only looking at the siblings and parents here. So sometimes it's a bit easier for people to accept that, oh, finally you have helped our son or our daughter to reach this stage, and the child has to leave care now and come back to us. In that case, you do the necessary things that you can do so that the child will be able to also accept that family member as his or her own. and live with the person and do anything with that person. So sometimes somebody will tell you, this is my brother. The brother is not the biological one. They are not coming from the same mother or father, but we combine in our system all these people, we just see them as coming from the same parents. Yeah, so we in Ghana, we have a broader system of family, or a broader understanding of who a family is. Yeah, that's what I have to add.
That makes sense. So, in some ways, I keep thinking that, family and mental health are both reflections, like how young people sort of view them. What's okay to talk about, what's not okay to talk about is still a reflection of the caregiving system. And the ways in which I think it's okay in those systems to talk about family, biological or not, and even mental health. To me, it gets around sort of the stigma of each. In some ways, that's what makes it kind of complex, I think, to sort of understand.
You want us to respond? Or any other person
No, I was
can do
throwing
that?
it out there.
Okay.
So we have 15 minutes. Are we not covering areas that you want to talk about?
Well, maybe I have a question in a way. Because as I said before, I just started data collection, and I had the impression when I got in touch with collaboration partners, because I'm not directly in touch with care leavers, but so I have to go over organizations who work with them, local authorities or NGOs, whatever. And the thing is, when I tell them about my research, they say mental health, great, suicidal ideation is an important topic, but touching that topic is something different. And so there is still something like, oh, we're way too scared when it comes to the practitioners to really touch this topic and ask people about it. So I don't know how you have experience when talking about mental health and doing your research, how you got, what kind of experience you had.
So I do think it goes back to what I just said, which is, I think studying these areas or trying to even understand them is inevitably linked to the systems that are serving young people. And so the ways in which these professionals and these organizations think about suicide and think about these harder kind of topics, I think will impact research. And like you just said, right? To me, it goes, I think something that Mark said yesterday in his talk is it really does go to those relationships, creating those relationships with those practitioners.
Because I think, sorry.
No, go ahead.
Being on both sides of that, like as a researcher trying to recruit young people and then being in organizations where people are trying to recruit young people, you have to know that the other person is safe or trustworthy in order to know that either your relationship with the young person won't be affected, or that you won't have to run around and fix up the mess that somebody else makes by doing things very wrong or, kind of ethically, unethically. So it's so difficult, especially if you're, if you've got pretty unrealistic kind of timelines around how you're supposed to build those relationships and things, then it's just so difficult.
I'm a bit distracted, but I think I have to do that. My research, I'm doing it actually with an intensive case management program where their whole focus is mental health and substance use. So it's a bit different because when you come in and you talk to youth, they're that's why they're there. They've been talking about that with the workers, and if they want to if they want to engage in research, they kind of expect that that's what they're going to talk about, even if it's not like an easy conversation, but it's kind of what they're there for. It's a bit different.
I think though, I guess let me try to say this better. When you're studying something that an organization is going to reflect badly on an organization, that's where it becomes challenging, I think, to ask those research questions and to even sometimes get access to the young people or even the professionals that you want to ask those questions of. Does that make sense? So if you were to ask about service delivery, for instance, would the organization be as good to work with? Like if you were going to reflect sort of a negative light on, you know what I mean? I think it does add this like layer of complexity. And suicide, I mean, that's such a touchy topic just in general.
Yeah. And also I think that mental health, because of its sort of clinical focus and sort of evidence-based and everything, it's often assumed that it works regardless of how it's done. So you can't question what the mental health services and responses are because they're like magical doctor people. So of course what they're doing is right. So that doesn't make it any easier, I don't think. And then also one of my frustrations with mental health, with working with young people in residential care, was that the program that was set up to address health needs required someone to go through 7 different assessments at different sites with different health professionals before they were referred on for counselling if they thought that mental health was an issue. So I had one client who wanted to go to counselling, and for 6 months as an intensive case manager, I couldn't find one service that she was eligible for counselling, even though she was at the highest risk end of anything that we would encounter in social work with young people. So I feel like the system says we've got those services and they're there and that's all you need to know.
But the access is something different.
Yeah.
Yeah.
Talking about mental health, actually, it's not a very comfortable subject, as you said. But here in Ghana, or perhaps looking at our culture and the way we are, when you talk about mental health, then we are thinking of you are not maybe sound in the head or something. There's that kind of notion about it. But sometimes maybe this can be posed as a question, but sometimes is it okay to try to refer, or we know some of the children, we know their backgrounds. So perhaps a child is not okay behaving in a certain way, then you try to refer to, okay, we know that maybe the person who gave birth to this child perhaps had a mental issue. So I don't know if it's okay to kind of refer and make assumptions. Because here in SOS Student Villages Ghana, we don't have a psychologist yet, an in-house psychologist, but there are plans on recruiting an in-house psychologist who come and help some of the children and even the caregivers, because we realize that they need it. But I don't know if it's okay to kind of make assumptions because this child it's behaving in a certain way. You can refer it to maybe his mother or her mother who might be mentally ill, and that's why the child was brought into care or something. I don't know if it's okay to do that.
Yeah, well, I think before you joined, we were talking a little bit about that, like the extent to which mental health is really properly identified and really understood in the context, I think, of chronic adversity, loss, trauma, poverty. I think it's really complex, and I would agree with you that more caution is needed than I think that we're probably using. And I think our research, at least, and in terms of practice, I think that's an open question. I don't know what you all think, but I think you're exactly right. I will also say, like, when I talk to young people in the United States, I think there's an assumption that mental health is a bad thing, and when they're diagnosed, it's negative. And that's not the sense that I get here. The sense that I get from young people is they often get help after they leave foster care. And when they're diagnosed with conditions, it really helps them to understand some really confusing challenges that they've had in their life that were undiagnosed, misunderstood, complex, and caused them a lot of problems because they weren't properly treated. You know, like a learning disorder, for instance. You know, young people, if they're not diagnosed properly, that can really cause significant difficulties in school. You know, and then that has an impact later in life, I think. So it's all my way of saying that I definitely agree with you. I think that more I don't know, high quality kind of assessments are really needed, and caution, you know, around labels.
Yeah, that's true. I mean, even here, I think there's even that kind of stigma on the care system.
Yeah.
Because from our work, we are, some of our young people, especially, you know, those in the boarding houses, you know, secondary schools, you know, they have to go to school, and sometimes when you visit them, it means you have to perhaps park the vehicle quite far away from the school, so you can, before you go to see them, you go to talk to them or see them or give them items, because some of them don't want to be, you know, when you come with a vehicle, there's SOS Children's Villages Ghana written on it, so it means their colleagues are going to know that, oh, so this boy or this girl is actually in an orphanage or a children's village, sort of. So it's sometimes I don't blame them much, but it looks like there's that stigma to attach to the whole care system being in an orphanage, or sometimes either it's pity or there's this kind of perception around it.
Well, a lot of the people that I've interviewed over time have talked about at schools how their caseworkers will come to their schools, and then that leads to stigma from teachers. But I think also some of the most unbelievably cruel bullying from other students. I think we know, like with online bullying and things like that, that people aren't afraid to say the worst things that you can think of to people. And so for kids to be like maybe at a new school, or to have all these problems with their family or all this other trauma going on, and then for kids at the school to be really mean to them would just be so horrible, and, you know, very difficult to get learning and anything else done, or to want to be there at all or feel safe.
For now, what SOS want to do is to, during admission, we want to ensure that the children are properly assessed, so that if they have any mental disorders, it can be identified, and then the appropriate support is given to that child. And then, as my colleague already said, there is the need to also train staff, also have the requisite knowledge on mental health, and also take away that stigma. Because if amongst us, we as workers, we are not able to, we don't have the requisite skill, we still stigmatize them, then you can imagine what will happen to them if they go outside. So the plan now is to have a psychologist, or if we can't have it permanently here, I will identify some who work with some of the government institutions, hospitals, so that during admission of children into the village, these assessments can be done, and then the right support is given. Because we also believe that it will affect, if it is not done well, it can affect their performance in school and their general life. And therefore, there's the need to do these things from the onset. Once the child is being admitted into the facility, we have to do that so that the necessary care is given to that child from the onset.
Mm.
Yeah.
I think That's right. It's on the one hand assessment, also identifying the needs and so on. But I was also thinking about this. It's also part of my research and why I'm doing this. What can help to prevent things like a really early training, something like that, to prevent, particularly when they are out of care, when no one is really around having a look for them, that their that their mental health is quite strong and stable, and that they can deal with adversities, what they experience then. So I think this is also another part of care, maybe, and the care system, how prevention can affect the mental health.
Can I say something about that while I have all my focus on you guys? That's I think this is what you're talking about. That's kind of the whole pitch of my research project is if we intervened early enough, we know that we can change trajectories in mental health disorders. And these youth that we're focused on, we know where they are, who they are, and how to access them. Like it's easy, quote unquote. It's a population that's at high risk. And I'm from epidemiology, so we focus on that all the time, but it's an easy one to find. You don't have to go look for them. So it's kind of just frustrating that we're not doing it.
Yeah.
So that's kind of, yeah.
I was thinking recently about, because when the lockdowns happened here, I was very worried about young people's mental health immediately, and then trying to find out what services are around and who we can refer to and all those sorts of things. But I was also thinking, like, in line with prevention and just with everybody not really feeling like they know that much about mental health, that a little bit more like psychoeducation could help everybody. And I think also when young people have an opportunity to learn about mental health, not be told that they're in therapy or that they have this or something else, but just to learn general principles about cause and effect. If these things happen to you, it's likely that these other things will be a part of your life at some time, and this is a natural reaction. It's all quite normal. And then also around other kinds of mental illness, just to know what's going on if they're experiencing it and what to do and when to go and speak to people, that sort of thing. I just think it's more kind of empowering than sending people off for treatment when they've already clearly at a crisis, because you won't necessarily notice until there's erratic behavior or other things going on, and it's a big problem by that time. So
I think what we've all tapped into are two things, and we could consider writing sort of a paper, since it seems like in all of our countries mental health is stigmatized, and it also seems like in all of our countries the approach to mental health in caregiving systems could also be better.
Yeah, so much better.
So
places they would consider themselves best.
It'd be interesting to sort of have this comparison of our countries and then our approaches, and then with a focus on prevention. So it's already 10:23. I think we are supposed to go back to our groups. They're recording this. I don't know how you feel about it, but I just wanted to take a temperature. Is it okay with you to have this recorded, or would you prefer not? I think we should take a vote.
Right with me.
It's fine with okay.
Well, I don't mind.
You don't mind, Mina? Petra, how are you feeling?
I'm fine with this. Yeah.
Don't mind.
Okay, then I will maintain it and give it to them so that they can post it, and maybe other people will join the conversation at some point. I wanted to say I really enjoyed hearing about your work, your countries, and everything that you're doing. I mean, how this is really a really neat opportunity, right? To sort of think about other countries and put it, I guess, put wellbeing care into context. Thank you for joining the conversation. Hopefully we can carry it on, right? This is hopefully just the beginning.
Yes.
Yeah.
Yes.
Yeah, such an understudied area, so I hope it continues.
Yep.
And just
okay, we'll go back then. I'll see you in a little bit.
Okay.
Okay.
Bye.
Bye.
Bye.